and welcome back. So, to begin this new setup and the new season, I have a poetic inaugural for all of you. Admissions 2000, graduation 2005, a good opportunity to high five. I welcome you all to experience and dive in great cherished memories and learnings of life. The time is ticking high to commence the conversations, that is the celebrated name of season 5. So, all these are friendly, jovial, all bright and light. Welcome all to Is Pharmacology Difficult podcast. I'm sure you all might be having a lot of questions, seeing a guest with me, and all a new setup, a kind of a new pattern also, that is interview podcast. First of all, before proceeding any further, I would just like to introduce our guest to all of you. Today's celebrated and the wonderful guest on our episode is Dr. Vivek Samore, Professor Otorhinolaryngology. So before I move over to the introduction of Dr. Samore, I would just like to say that this is the season 5, a new season of my podcast where the name of the season 5 is The Conversations, and today we are having The Conversations with Dr. Vivek Samore. I dedicate and devote this season to the talks with my graduation batchmates to know about their current updates and life. So this would be a kind of a very fresh and novel and lively deviation from the regular seasons of my subject, pharmacology. So without any delay, we won't keep Dr. Samore waiting for long. You are welcome to The Conversations Season 5. A very hearty welcome to Dr. Samore. And first and foremost, Dr. Samore, I would like you to please introduce yourself to all of us.
थैंक यू राधिका. सभी को नमस्कार. मैं डॉक्टर विवेक सामोर, प्रोफेसर एंड हेड ऑफ द यूनिट डिपार्टमेंट ऑफ ईएनटी एंड हेड नेक सर्जरी in SP Medical College and PBM Group of Hospitals, Bikaner.
Okay, so you are at present working at SPMC Bikaner and you were always there only, or you had the same place always?
No, same place. From my birth, since my birth, मेरे जन्म से लेके आज तक मैं यही हूँ. As a UG,
Okay.
as a PG, as a schooling sir Bikaner में. और
That's
my
very
assistant,
nice to
associate
know.
and now professor.
Very wonderful. So, first and foremost, we like to know from you, Dr. Vivek Samore, that how much you're enjoying your subject ENT, ear, nose and throat, which we call as otorhinolaryngology.
I'm enjoying my subject very much. ENT एक ऐसा सब्जेक्ट है जिसमें माइक्रोस्कोपिक सर्जरी भी है, लाइक माइक्रोस्कोपिक ईयर की सर्जरी होती है. मैक्रोस्कोपिक आंखों से नेक डाई सर्जरी लाइक हेड नेक सर्जरी भी इसमें है. एंडोस्कोपिक सर्जरी भी इसमें है जिसमें आप एंडोस्कोप के थ्रू सर्जरी करते हैं. प्लस में मेडिसिन, पूरी मेडिकल प्रैक्टिस भी इसमें आप कर सकते हैं. तो एज ए होल कंप्लीट सब्जेक्ट है जो ट्रीटमेंट है. ये ईएनटी जो ब्रांच है, कंप्लीट ब्रांच है.
That's wonderful. And do you think that you were chosen for ENT?
डेफिनेटली.
Wow, that's wonderful to hear from you. Was this one of your favorite subjects while you were studying in graduation?
In graduation, all surgical subjects were my favorite subjects like general surgery, orthopedics, IE, ENT, all surgical subjects are. ये सभी favorite
I
थे
would
मेरे.
say that you are very lucky to get one of your favorite subjects for adopting throughout your life in such a competitive era.
Definitely.
So that's a very nice thing and wonderful thing to know.
Thank you.
Next, I would like to know what are the most significant achievements that you remember till date in your professional life?
Till date, my joining as assistant professor in my parent college, जहाँ पे मैं एज ए अंडर स्टूडेंट के रूप में एंटर हुआ, जहाँ से मैंने सारी अपनी यूजी और पीजी की पोस्ट ग्रेजुएशन किया, वहीं पे मैं एज ए टीचिंग फैकल्टी ज्वाइन किया. लाइफ का मेरा सबसे बड़ा अचीवमेंट है और मेरा ड्रीम भी था और वो मेरा ड्रीम ईश्वर की कृपा से पूरा भी हुआ.
That's so wonderful to hear again. Again, I would say you are very lucky to have such a dream come true in such a competitive era.
Thank you.
So I really congratulate you for having such wonderful
you.
memories and such achievements. Now, next, a very interesting question is coming up for Dr. Vivek. We want to know that any interesting event or any interesting incident he remembers from his student or professional life that he would like to share with all of us.
ऐसे बहुत से इंसिडेंट्स है, काफी लिस्ट बनाने लगेंगे तो अपने सुबह शाम हो जाएगी। इनमें से एक इंसिडेंस है जो मेरा एमबीबीएस का फर्स्ट डे का जब मैंने एंटर किया था उस दिन का है। उस दिन एक्चुअली मेरा ज्वाइन जाने का मूड नहीं था, तो मेरा एक जस्ट कलीग था डॉक्टर विवेक उज्जवल, जो मेरा बहुत अच्छा फ्रेंड है। उसने वो मेरे घर आ गया और उसने मुझे इंसिस्ट किया कि फर्स्ट डे पे जब कॉलेज जाते हैं तो जो मिस बॉस होती हैं, सीनियर्स मैडम जो हमारी बॉस होती हैं, वो सबको फूल देती हैं। तो उसने कहा आज तो जाना ही चाहिए अपने को। तो इस लालच में उसने जबरदस्ती मुझे उठा के घर से ले गया और कॉलेज में जाना जरूरी है, लेकिन कॉलेज तक हम पहुंच नहीं पाए और बड़ा हैरानी की बात है, रास्ते में हमारे सीनियर्स ने हमारे को हाईजैक कर लिया और हमारी रैगिंग हुई जम के। तो वो दिन आज तक मुझे याद है। उसके 2 दिन बाद मेरा जन्मदिन भी था, तो हमेशा इंटरप्रिटेट करते हैं कि 20 सितंबर हमारा ज्वाइनिंग डे था। उसके बाद से मतलब बहुत ही मेमोरेबल इंसिडेंट है मेरी जिंदगी का।
You had the picture of the rose in your mind, and in anticipation of rose, there was a sudden turn, an opposite turn of events. So I'm sure many
बिल्कुल,
students
जो सोचा उसके जस्ट
many
अपोजिट
students would correlate with this incident.
बिल्कुल, जो सोचा उसके जस्ट अपोजिट हो गया।
Surprising and such surprising
Unexpected,
and
unexpected.
things that happen.
बिल्कुल बिल्कुल।
So this is a very hilarious incident that you shared with all of us, and it would be like a great correlation and a thing to cherish by many students who might have experienced such things or similar
बिल्कुल।
things.
बिल्कुल।
So that is a great thing to know. Again, I would like to ask you next important and very wonderful question. See, apart from the medical stream, we all know that medical sciences and those who adopt these medical sciences as doctors, they have a very hectic and very busy routines. It is not always possible to always study or to stay in a kind of a mode of operation and like definitely we are treating patients, we are meeting patients. We need time for ourselves sometimes, and I would say that since you are in a clinical subject, you definitely get less time as compared to non-clinical. But definitely, everybody needs a rescue from such a hectic routine. What are your hobbies or your modes of rescue to keep yourself refreshed and entertained sometimes, and keep on going to face such a hectic routine? How do you find time for your hobbies also?
मेन हॉबी तो मेरी किशोर कुमार के गाने सुनना और किशोर कुमार के गाने का शौक ही है मेरे को। और रही बात हॉबी के लिए टाइम निकालने की, तो एक्चुअली जिस चीज में आपका इंटरेस्ट है उसके लिए टाइम निकालने की जरूरत नहीं पड़ती, आप अपने आप टाइम निकल जाता है। उसके लिए टाइम निकालना उन चीजों के लिए पड़ता है जिसमें आपका इंटरेस्ट नहीं है। तो जो आपको मन से कोई चीज करनी हो तो उसके लिए टाइम आप आराम से निकाल सकते हो।
So I would like to quote this sentence. From Dr. Vivek Samor, a very important and wonderful sentence for everyone. Whatever you like and whatever you are interested in, the time is automatically created and it keeps you refreshed. So you don't need to find time for your hobbies. It is automatically created. Such a wonderful sentence and such a wonderful quote that we got today from Dr. Vivek Samor. And since he has shared with us that he likes singing, he has been singing. Now, how is it possible that we can let go him off without singing? So, I'm sure you are expecting that he would definitely sing a few lines of one of his favorite songs for all of us.
बिल्कुल।
Please, Dr. Samor,
Thank you।
do this. I hope you make our wish come true also.
हाँ, 2 लाइनें जरूर गाएंगे। चेहरा है या चांद खिला है, जुल्फ घनेरी शाम है क्या, सागर जैसी आंखों वाली, ये तो बता तेरा नाम है क्या। थैंक यू।
Thank you so much. This was a wonderful, melodious voice we got to hear from Dr. Vivek. And I'm sure the clapping was not very much. You all might be clapping at your end also, everybody is watching. And thank you so much for singing for all of us. Now next, wonderful question I have for Dr. Vivek Samor is one future wish, plan, or idea he has in his mind that he would like to share with all of us.
एज ए लाइफ प्लान, लाइफ में गुड टीचर की बनना चाहता हूं मैं, कि जिसमें अपने जितनी भी अपनी ब्रांच की डिटेल, ये जो फाइन चीजें अपने स्टूडेंट्स को बता सके। बस यही अपना प्रोफेशनल में लाइफ मतलब गोल है, एज ए टीचर, गुड टीचर। स्टूडेंट याद रखें गुड टीचर के रूप में मुझे।
This is again a very wonderful dream or aspiration of Dr. Vivek, that he wants to be remembered as a wonderful teacher for the students. So again, he's thinking for the students, and those who think that he's a wonderful teacher already, they might be very happy that he would be improving upon, and he thinks he should be improving upon his teaching skills, which we don't know what he would do, but as far as we know, he's already on such a position that he's, I think, quite a wonderful teacher and a guide for his subject to the students. One again related question, and the last question of this question answers that I have prepared for him. I would like to ask him one piece of advice that he would like to steal from his treasure of learnings and experiences and share for all the aspiring doctors and the students.
इसमें मैं सबको एक ही बात कहना चाहूंगा कि ये जो नोबल प्रोफेशन है, मेडिकल प्रोफेशन, इसको केवल ह्यूमैनिटी को सर्व करने के लिए ही ज्वाइन करें। मेन एम, प्राइमरी एम कभी भी अर्न मनी नहीं होना चाहिए आपका। आप मनी को लेके इस प्रोफेशन में एंटर करेंगे तो ये बहुत गलत है। आप सिर्फ सर्विंग के हिसाब से, आप सर्विस देने के लिए, अच्छे पेशेंट्स को अच्छी केयर दो, पैसा अपने आप आ जाएगा, बहुत ज्यादा नहीं, लेकिन आवश्यकताएं पूरी हो जाएगी। इस पेशे में यही इसका मेन जो इसका मोटो यही है।
Again, we have some wonderful. So today we are having a lot of many wonderful dreams, aspiration quotes from Dr. Vivek, which we can actually note down and keep it safe for our in like following and follow up things, that we should always be keeping these things in mind, that this is basically a service based profession and not a money based profession. And if you have such wonderful and such noble ideas, you can definitely perform well as a doctor and become a wonderful doctor. I think so. That's what his basic
यही सोच
idea
लेके हम
is
इस
of
प्रोफेशन
sharing
में आए
for-
थे। बिल्कुल यही सोच लेके इस प्रोफेशन में आए थे और टिल डेट आज तक इसको मेंटेन किया।
That's wonderful, Dr. Vivek. So
Thank
that's all the question answers that I had prepared for him. Anything you would like to add from your end?
बस नो, थैंक यू।
That's so. Thank you so much, Dr. Samor, for this wonderful, inspirational, and warm talk with all of us. I'm so glad you joined me today for my podcast. Hope you all enjoyed listening to Dr. Vivek and about him from his own mouth. One of his social media links will be shared in the show notes as per his consent, because as far as I know, he's not a very active person on social media. So as per his consent, we would be sharing. And lastly, we would be having a regular outro. For all the updates and latest episodes of my podcast, please visit www.ispharmacologydifficult.com, where you can also sign up for a free monthly e-newsletter of mine. It actually contains a lot of updates for medical sciences, drug information, and my podcast updates also. You can follow me on different social media like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name, is Pharmacology Difficult. If you're listening for the first time, do not forget to subscribe and follow me whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you. And thank you, Dr. Vivek, for joining us today. So
Thank
here
you,
we
thank
end
you, Radhika.
today's episode of The Conversations Season 5. Thank you so much.